welcome back to my channel Bio360. Today we will discuss mechanism of breathing. So the breathing process involves two stages. The first one is inspiration, during which the atmospheric air from the outside environment reaches our lungs, and the second one is the expiration, in which the alveolar air is released out. The movement of air into and out of the lungs is carried out mainly by a pressure gradient between the lungs and the atmosphere. Inspiration can be occur because of the pressure gradient, that is, the lungs pressure known as intrapulmonary pressure should be less than that of the atmospheric pressure. So there is a negative pressure or less pressure in the lungs when compared to atmospheric pressure. So it causes the air from the atmosphere to reach the lungs. Similarly, for expiration, the pressure in the lungs, that is intrapulmonary pressure, should be higher than that of the atmospheric pressure, which causes the expulsion of air from the lungs to the environment. All these processes need some help that is given by diaphragm and some of the special muscles. They are external and internal intercostal muscles. These muscles are present in between the ribs. This helps in generation of such gradients. Inspiration is initiated mainly by the contraction of diaphragm, which causes the increase in the volume of thoracic chamber in anterior-posterior axis. As you can see, the diaphragm, which is in dome shape due to the contraction of its muscles, will change its shape to flat, so that now it becomes flat. Now the thoracic chamber increases its volume by anterior posteriorly, so that the volume is increased here, and due to increase in volume the pressure is decreased in it, so that the air will enter the lungs. The contraction of external intercostal muscles will lift the ribs, and also it lifts the sternum, which causes increase in the volume of thoracic chamber by dorsoventral axis. This overall increase in thoracic volume causes the decrease in the pulmonary pressure. Due to the increase in the pulmonary volume, as we know, when volume increases, pressure decreases. An increase in the pulmonary volume causes a decrease in the intrapulmonary pressure less than that of the atmospheric pressure, which will force the air from the outside to move into the lungs. That is inspiration. Whereas when the relaxation of the diaphragm and the intercostal muscles return the diaphragm and the sternum to its normal positions, which cause the reduce of the thoracic volumes, and thereby it will cause the decrease in the pulmonary volume too. This leads to an increase in intrapulmonary pressure slightly more than that of the atmospheric pressure, which will cause the expulsion of air from the lungs, that is known as expiration. We have the ability to change the capacity of our expiration and inspiration, that is provided by the additional muscles present in our abdomen. On an average, a healthy human being can breathe for about 12 to 16 times per minute, which is an indicator of an healthy person. The volume involved in such movements can be measured with the help of a special device known as spirometer, which can also be used for clinical assessment of pulmonary functions. Hope you like this video.